Karen had recurrent episodes of cellulitis. So that's infection in the skin. Why don't you tell us how it would look and feel?
It would hurt, basically. That's all I knew. If anything barely touched it, it was just a familiar feeling of, I know what that is. Well, I was going to say I would look at it.
Right.
And just scope it out, and yes, usually there was a sore on it.
And it would get hot, because I'd take my hand and just barely go over it. And it hurt. And it was always between the ankle and the knee. And then it would get swollen. And the swelling would be from the infection, but also you had edema that you could push in, pitting edema. We were on about the 4th episode, and in about 12 days, we weren't changing it. She wasn't getting worse, but she wasn't getting better. And we have problems, so we have to...
It gets literally hot to the touch.
But this area down here, in the past, before she arrived, they had an abscess or infection. So this calf area was not normal.
It's a shin bone.
Right, up here. And there would be all these little ulcers and sores and openings, which each one by itself didn't look that big. But they, together, were pretty impressive.
And then came your wonderful invention or patch, and it kept the bugs out.
Well, not only kept them out, I think it a bit killed them. And so this is the patch
no more food.
she's talking about, which works based on a very high concentration of oxygen. And the oxygen also lets the wound heal. So basically it puts the sign on the door of the hotel saying, "We're full, you can't come in here anymore." And so what happened was, I was shocked. These are good for 5 days, but I had to take it off in 4 days because of my schedule. And I was going, and it was improved. We put a second one on, and by the 9th day it was resolved. But the other neat thing was...
Isn't that great?
That's awesome.
That is just great.
If someone loses a leg, statistically it's a 50% probability of losing the other leg in 2 years. So I have promised Karen that's not going to happen with us. And so, on the other hand, I was really being limited by the amount of antibiotics I could use. So Karen's off the antibiotics, the leg looks great, there's no little holes and excoriations and fancy doctor words. And she's doing great.